there's a 4-question test that you can ask yourself or ask somebody else. The first is, do you snore loudly? The second is, has someone seen you stop breathing during your sleep? The third is, do you feel either sleepy or tired or both during the day? And the fourth is, do you have high blood pressure or are you being treated for it? And if you answer 2 of those questions, yes, then you have a high chance of having sleep apnea. There are 95 sleep disorders, believe it or not. Sleep apnea is a very common condition. It affects more than 20 million Americans, and it can be not only troublesome to the patient as far as symptoms, but it can be dangerous. It can shorten their lives.
It can also affect things like your cognition and memory, especially if it's associated with drop in oxygen. But sleep studies have confirmed that sleep apnea increases your risk for many health problems, what we call vascular problems, like an increased risk for heart attacks, increased risk for stroke, increased risk for type 2 diabetes. That's all the bad news. The good news is that sleep apnea is very treatable, and we have actually put together a very nice team at Mary Washington Sleep and Wake Disorder Center. We can help you treat it with CPAP, oral appliance, even weight loss, and other modalities to help you go through treatment. And then you can go back and be as good as someone who does not have sleep apnea. One of the things that we do here, and I especially do as a neurologist, is I try to weed out what exactly is the problem with your sleep, or what exactly is the problem with you sleeping too much, or why are you tired. Nice to meet you. I'm Dr. Alatar. We need to look at your lifestyle and see what you do. So I go through a whole list of questions to find out what you do pretty much every hour. Okay, how long do you think you've been snoring? Sometimes I find 1 or 2 things that make a difference in why you're not sleeping or why you're feeling tired.
Once you have your history, you can form an idea of what they probably have. The physical exam may help too. For example, the child with enlarged tonsils may have sleep apnea because of the enlarged tonsils, and taking the tonsils out may be curative for the child. Then after that, you study them. You know, and if you're thinking of sleep apnea, we do a procedure called a polysomnogram, where they come in at night and are studied to see if they stop breathing during their sleep.
Stress from my job.
Okay. We actually do what I call multidisciplinary approach to treating patients with sleep problem. When it comes down to treating somebody with sleep problems, you really have to look at the big picture. It's not just about, oh, let's see if you have sleep apnea and rule that out, even though that's one of the big, one of many facets of treating a patient with sleep problem.
Sometimes people come here and they think that they're literally just going to lay in the bed and sleep and we're just going to look at them. But all these different pieces of equipment need to be attached so that we can monitor their body's electrical activity and muscle activity, brainwave activity. A lot of times looking at all these wires can be a little intimidating for some people if they've never gone through anything like this before. The most important thing for the testing procedure is to make sure that the patient is at ease.
We greet our patients, take the patients back to their room.
Welcome to the sleep lab. Your room is right here on the right.
Introduce them to the room, show them around.
Just to orient you with things real quick, there's a camera in the room.
We try to have an environment that is like a hotel or a motel, you know, where they don't feel like they're in a hospital bed, and they're not. You know, we have a 4-poster bed that's comfortable. We have a plasma TV in their room, and it's a private room with a private bath and shower. And so we try to make them feel like this is a visit to a hotel and not to a laboratory.
We'll have them get dressed, and we proceed with applying a lot of electrodes on their head, underneath their nose to help them breathe, belts around their chest and abdominal area.
This is a respiratory effort band. It monitors the chest and stomach movement. Your chest and stomach move like a bellows to facilitate air movement and help with breathing. And this is just going to monitor that effort. This is a nasal mask. Some masks go over your mouth as well as your nose. Some are actually smaller than this.
And we have a certain criteria that if you stop breathing by 2 o'clock in the morning, you have to have so many events, then we would put this CPAP mask on you.
CPAP stands for continuous positive airway pressure, and what it is, it's a mask connected to a hose and a machine, and it delivers high pressured air, And what it does is that it keeps this upper airway open, the throat, let's say. Keeps it open because what's happening with apnea, it's collapsing, shutting off air, and so it keeps it open so you can breathe like you do right now when you're awake.
A lot of people tolerate it well from the start. For those who don't, we can help them. We do something called CPAP desensitization, where we can bring them into the lab, and that's free of charge, and we go through the equipment with them, try them on different devices, find out what their problem is, and help them.
We have them lay flat, lay on their side until they get used to it and slowly increase the pressure. And most of them come out of here like, I can do this. It's just talking to the patients, letting them know it's okay. If something comes off, we're right there. We're watching them in a control room. We can see and we'll fix it. If they're in a certain period of sleep, we're not going to fix it. We're going to wait till they get out of that period of sleep because we have like backups. So it's okay.
Okay, partner, you ready?
There are certain sleep disorders that are only seen, or at least mostly seen, in kids.
I need you to scoot down and lay flat on your back.
Sleep apnea can certainly be seen in kids. Sometimes they have special types of sleep-related breathing problems that we look for, central sleep apneas or hypoventilation. Those are things we look for.
I'm going to turn the lights out now and call you from the tech room and ask you to do some different movements. Okay. All righty.
We will introduce the children to the bedroom. We show them the electrodes. We let them play with the electrodes. We also give each of our children a teddy bear. It's a very simple teddy bear, but it's something that's theirs to hold during the night and to keep. Most of our technicians are, parents themselves, and everybody deals well with the kids. We like it. It's a lot of fun.
Okay, I'll call you in just a second.
Lights are turned off and then they're asked to go to sleep, and then the recording begins. And the recording is what I would be looking at. I look at it, every single minute was looked at by the technicians and by the physician.
I'm going to ask you to do a number of breathing exercises just to test the equipment. We monitor by video and also by microphone so we can see and hear the patient during the night. And we do that because to be available to attend to any of their needs, we have to listen for them to call, as well as we monitor their position because it can affect their breathing depending on whether they're laying on their side or back. We
have a computer screen, and every 15 seconds is monitored on our screen. We have 6 brain waves we're looking at. We're looking at your eye movements, because if you go into REM, which is your dream sleep, your eyes blink like if you're awake, and you can actually see it. If we can zoom in on the camera that we have on you, we can see it.
We look and see if you have a lot of leg movements, if you toss and turn, how much, and whether you go into deep sleep or not, or into dreaming stages. We also look for abnormal movements, like people who sleepwalk or people who sleep talk. We look for these things. We look for seizures. We also look for people who grind their teeth, and so forth. Then in the morning, about 6 o'clock or so, the patient is awakened, and then they get unhooked and they go home. And they will follow up with one of us or with a primary physician. We go over the sleep study with them. It's a one-night stay for most people. There are exceptions.
If the person's sleep apnea is bad enough and we can diagnose it with certainty early enough in the evening, we can just wake them up and put them on CPAP, find their prescription, and do it all in one study. I have people come in and say, that first night on CPAP was the best sleep I've had in years. And some people it takes longer than that. Some people it takes them a month or so before they start feeling a lot better. But usually it really does change their life around.
When a person finally recognizes they're sleeping well, the first thing they tell me is, oh, my mind is clear. I was in a fog, and now my mind is clear. I can see things better.
I had a wife that dragged her husband in. She was saying, I can't go to a movie with him. He sleeps during the movie. We have no family life. And then his 2 boys spoke up and they said, we don't have a dad anymore. This was coming from a 9-year-old and a 7-year-old. We don't have a dad anymore. He comes home and he sleeps on the couch. He won't play with us. And we got him, a little reluctantly for him, we got him diagnosed and treated. And I saw him in follow-up and they were just as happy as can be. And I put in his dictation, we've got our dad back.
We're accredited by the American Academy of Sleep Medicine and also by the Joint Commission. We're the only accredited sleep lab in this area. What it means is that our lab, including our physicians and our technicians, are held to a specific national standards. And so the care is given is as good as the care given in very reputable institutions around the United States.
It's the gold standard of accreditation, and it's something you strive for. There's a spirit of pride and togetherness around here, if you will, among the technicians and the technologists and ourselves.
You walk away with the patient actually being treated for good. And so that's why I'm here, that's why I'm doing this.
It's a great place for patients to come to. We try to go the extra mile and make sure our patients are comfortable, that we educate them and follow up with them. I think we're all striving for that. I think we're all doing that.